So when dealing with a bicep strain of any kind, either mid-substance or what we'll typically say is a little bit of that strain that kind of leads up into that shoulder, more long head of the bicep, we still want to train the bicep only because it's a big mover, it's an important muscle group, but what people tend to miss most of the time is the main action of the bicep is not necessarily elbow flexion, it's actually supination. So this is a super easy hack. You're going to see this a lot, and we'll do this a lot, to call on the bicep. And as long as they can set this up at home on their own, this is a great home exercise for them too. So as Jason here takes his hands, which is going to be more or less in the pronated position, this is a nice elastic band. I put a towel just for the grip alone. He's going to supinate or turn his palms up. He's going to hold it for a couple seconds. You're going to see this bicep really kind of bunch up and really be active. We're going to have that nice sustained hold. So go ahead, Jason. Give it that nice little twist. Bring it up, and that bicep is going to be super active. So here, I love using the isometric sustained holds. This is pretty functional because how often do you find yourself holding things close to your body with the elbow flex position? Super functional when you stop and think about it. Easy to set up, and it really helps attack that bicep the way we want it to. I like to do this after I do some electro dry needling, and you can see I've done some myofascial decompression. So I did use some cups, decompress that tissue just for that soft tissue work, and now we're loading it. Remember guys, after we do anything manual, soft tissue related, we gotta load the tissue. Otherwise we're just doing passive treatments that they're gonna need us for the rest of our lives. I don't mind seeing people for life, but I also want them to get better. Easy to do, easy to set up. So when you're seeing somebody with bicep, long head of the bicep, front side of the shoulder, if they're trouble with the dip, anything pressing like bench press, try this as far as a regular routine. You're going to notice a huge difference when we talk about treating the bicep, treating anterior or front side shoulder pain, and it has a nice application for forearm, medial, and lateral epicondylitis too. Bang for your buck, guys. Easy to do. Do this.